Welcome to Module 2 of the Eating Disorder 101 workshop, brought to you by the Windsor Essex Intensive Outpatient Program. In this module, we'll be talking about treatment and nutrition therapy for eating disorders. My name is Sarah. I'm a registered dietitian with the Windsor Essex Community Health Center and with the Windsor Essex Intensive Outpatient Program. The Windsor Essex Intensive Outpatient Program is brought to you by a partnership between Windsor Regional Hospital, the Bulimia Anorexia Nervosa Association, and the Windsor Essex Community Health Center. It's a treatment program intended for individuals with eating disorders who are 16 years old or older, and it offers groups, individual sessions with dietitians, social workers, nurse practitioners, and some of the groups provide psychoeducation around eating disorders and offer meal support where you can bring challenging food and meals and have them in a supportive group environment. Today, you'll also hear from social workers Alexis and Rose. On today's agenda, we'll be covering many different topics. These topics include what treatment looks like, medical support, nutrition therapy, and psychotherapy for eating disorders. So before we get started, it's important to note that this workshop is intended for individuals with eating disorders or disordered eating, parents or caregivers, or healthcare professionals looking to learn more. This workshop is for educational purposes only. This workshop is not intended to substitute any medical, nutritional, or mental health advice. This workshop is intended to provide general resources and information on eating disorders and disordered eating. This workshop is not meant to address individual concerns or provide individual advice. Some of the topics covered today may be difficult to hear. If you are in need of immediate support, please contact the Community Crisis Center of Windsor's 24/7 helpline at 519-973-4435, or you can access the National Eating Disorder Information Center live chat or phone line at www.nedic.ca.
Eating disorders require treatment. Eating disorders aren't a lifestyle choice or a diet that's gone too far. Eating disorders can affect a person's health, relationships, quality of life, or performance, whether that's at school or work. Early diagnosis and early intervention can improve recovery from an eating disorder. So in other words, the sooner that we detect an eating disorder and treat it, the better. There are various types of treatment depending on the person's unique needs. This is determined in collaboration with the person and the care team. It may depend on how much support the person may need and what kind of medical support they may require for their recovery. Starting from most intensive to least intensive, we're going to start with intensive inpatient programs. Intensive inpatient treatment programs are usually located in hospital settings. Here in Windsor, Essex, we do not have any intensive inpatient programs. People who are eligible for these programs typically require urgent medical stabilization or urgent medical treatment. Next, we have residential treatment programs. These are typically in hospital or psychiatric facility settings. Again, currently, Windsor, Essex, we do not have any residential programs. So for residential programs, the criteria is that the person does not necessarily require full-time medical support. However, they would benefit from more psychotherapy and more therapeutic support in their day-to-day life to recover from the eating disorder. Next, we have intensive outpatient. So currently in Windsor, Essex, we do have an intensive outpatient program that is community-based, and this is done in collaboration with BANA and weCHC Teen Health Center. The criteria for the intensive outpatient program is to be medically stable, but needing some ongoing support in someone's day-to-day life. So what this looks like is psychotherapy with some meal support and group support for people who are 16 years old and older. Next, we have outpatient services. Outpatient services are community-based and are offered at weCHC Teen Health and at BANA. People who are eligible for outpatient services are medically stable and don't require as intensive support as listed above. So what this looks like is once a week or twice a week psychotherapy to help that person achieve recovery in their day-to-day life. Your eating disorder treatment team consists of a medical provider, so that could be a doctor or a nurse practitioner, a registered dietitian, and a therapist. The frequency and type of support for eating disorders can vary from person to person, depending on the person's unique experience of their eating disorder and the symptoms they may be experiencing due to having one. Getting medical support is an important first step in detecting the eating disorder and making sure that you get the right level of support. The medical complications from having an eating disorder can impact the person's social, physical, and emotional well-being, and the registered medical professional can help that person navigate that process of getting support and making sure that they're medically stable and healthy. Let's talk about weight. There are many factors that can impact someone's biologically appropriate weight. Biologically appropriate weight refers to when someone is not maintaining any dieting practices and their body and mind is functioning at its happiest. There are many things that can impact this, which include genetics, age and height, life stage, so this could be puberty or pregnancy, blood volume and organs. So for example, blood volume increases and organ size increases when someone is experiencing puberty, development of the person's sex organs, metabolism, chronic health conditions, so this can include diabetes, medications, body fat, and muscle mass. Biologically appropriate weight is a much more appropriate way of thinking about weight than BMI. This way of thinking and framing weight can help support development and growth, can improve preoccupation with food, and lastly, can help someone discover the weight appropriate for them when their mind and body is functioning at its happiest.
Let's talk about nutrition therapy for eating disorders. Medical nutrition therapy for eating disorders is an evidence-based treatment that involves individualized food plans and helps support individuals to meet their treatment goals. Let's dive a little bit deeper into some important messages in nutrition therapy for eating disorders. The first one I'll talk about is variety. Variety is key in the sense that it's important to include a variety of foods from all different food groups. Another message that we often talk about is that all foods fit. We often use this to emphasize that there are no good or bad foods and that food has no moral value. And it helps to remove any judgments formed by diet culture and wellness culture. Another message that we talk about is that food is medicine. Eating disorders are definitely more than just about the food, but food and normalization of eating is a key part of eating disorder treatment. It's very important, especially in the initial phases of treatment, to replenish what was lost as a result of malnutrition. Last but not least, another important nutrition message that we talk about in treatment is that mechanical eating must come before intuitive eating. It's common to lose touch with proper hunger and fullness signals when struggling with an eating disorder. Mechanical eating means that you're following an eating schedule regardless of how you feel. Intuitive eating, which we'll get to later on in treatment, is a personal process of honoring your health by listening to your body to meet your physical and psychological needs. But before we can practice intuitive eating, mechanically eating can help to build awareness of those lost hunger and fullness cues and weight restore if that is needed. Nutrition therapy involves developing an individual nutrition plan to meet your own needs. This can mean looking at energy, macronutrient, and micronutrient requirements. Let's dive a bit deeper into each of these. Macronutrients can be obtained from carbohydrates, fats, and protein. Despite what diet culture says, carbohydrates are a good thing. They are the body and brain's main sources of fuel, so it's important to include them in our daily meals and snacks. Fats are also an important part of our nutrition needs. They help make up our brains, hormones, and cells, and they are essential for absorption and delivery of certain vitamins. We also need to include protein because they are the building blocks for our body and help support our immune system and muscles and various organs. We also get micronutrients from the food that we eat. Micronutrients are also known as vitamins and minerals. Micronutrient needs can differ by age and biology. They can help your body use energy provided by the macronutrient. They also play a role in immune function, growth, and development. You can generally get enough from a balanced diet. However, you can speak to your doctor, nurse practitioner, or registered dietitian to determine if a supplement is needed. In eating disorder treatment, food plans help to meet individual goals. Food plans help to meet nutrient and energy needs. They provide an organized approach to food intake, and they help desensitize binged or feared foods. Here, you'll see a few examples of food plans that can be used in treatment. There's the rule of threes, which recommends 3 meals and 3 snacks per day, and foods are grouped according to nutrient content. Fun foods are also incorporated into meals and/or snacks. There's also the exchange-based system, where foods are grouped according to nutrient and energy content, and can then be organized into meals and snacks or food groups. Lastly, we have the plate-by-plate approach, which is another food plan that can be used. It is used as a visual plan, breaking down the food portions on a 10-inch plate, and can be used for parents who are plating food for their child with an eating disorder. By the end of this treatment, here are some general goals we hope to see. Variety and balance of foods is one of the goals we hope to achieve. We also want to be including fun foods or forbidden foods in our regular eating. We hope to see some intuitive eating and flexibility, and we'd like to return to the pre-eating disorder eating, or what was once your normal eating pattern. And lastly, we might need to redefine healthy eating.
Okay, so the next thing that we are going to discuss is psychotherapy for eating disorders. Now, eating disorder treatment is complex and it requires specialized care by a trained therapist. Treatment can take place in a few forms. It can be family-based, individual, group-based, or some combination of these things. And at all times, we're really looking to treat the whole person in a holistic way and as part of a multidisciplinary team, as we've already been discussing through this module. So the first treatment that we are going to discuss is called family-based treatment, or FBT. And now some central features of FBT are that first and foremost, family plays a critical role as part of actually providing the treatment to the individual with the eating disorder. And at all points along FBT, we are really working hard to separate the person from their illness so that no blame, guilt, or shame is placed on them, and the focus is on getting better. And we really focus on moving forward and moving through treatment, and a lot less on what may have caused or led to the development of the eating disorder, unless there's some things that might be making it hard to progress in treatment. Family-based treatment, or FBT, takes place in 3 phases. In phase 1, which can often feel like the most intense part of treatment, we're doing a few things. First, parents or caregivers are given full control over all decisions related to food, eating, and other areas of life, and we're looking to accomplish 3 main tasks here. First is medical stabilization, the second is nutrition rehabilitation, as Sarah already discussed, and the third is symptom or behavior interruption. Now in phase 2, we work on a gradual return to independence for the person in treatment, and both related to eating and other areas of life. At this point, if there was concern around weight, that person will be at or pretty close to their biologically appropriate weight. And we're working on a lot of challenge situations, fear of foods, and other things that may keep the eating disorder going. And finally, in phase 3, we're really hoping to get that person back on track with normal development, whatever that means for them, their age and stage of life. We're hoping to continue working on identity formation, and then really importantly, on how we maintain and protect all the hard work that you put in treatment. And another really common form of treatment for eating disorders is called enhanced cognitive behavioral therapy, or CBTE. Now, this is an adaptation of CBT, which is specific to the treatment of eating disorders. And CBTE is considered transdiagnostic, meaning that the base model or some adaptations of it should be able to address most eating disorder diagnoses. And although it's a very structured form of treatment, it is also very individualized to the person and their experiences with an eating disorder. So CBTE also takes place in phases or stages. So stage 1 is called starting well, and here you're doing a few things in partnership with your therapist. You're doing a really thorough assessment or formulation of your eating disorder so that you both reach a shared understanding of how it operates and how it affects you. Your therapist is going to provide a lot of education on both treatment, eating disorders, and a lot of related subjects, and they're going to introduce something called real-time self-monitoring, which I'm going to discuss in a moment. Now, in stage 2, which is pretty brief, you're going to just work on reviewing your progress so far, making sure that you're staying on top of that monitoring, and just adapting to treatment in general. Stage 3 is where you're going to really explore those maintaining factors or things that are keeping your eating disorder going. So this may mean body image concerns, eating patterns, mood, environment, or other factors. And then finally, phase 4 is when we're really looking to shift that future orientation, address any natural setbacks that you may have, and again, we want to work on maintaining and protecting progress. So a really central feature of CBTE is something called real-time self-monitoring. And this is not the same as food logging that you might see on a dieting app. It's really specific to this form of treatment. So you are recording details related to what you've eaten, where, and when, but you're also exploring how were you feeling and what was going on at that time. And then from here, you can work really closely with your therapist and treatment team to understand patterns that may be occurring that are keeping your eating disorder going. And it really also helps with building individual awareness as you go through your day and keep track of these details. When coming into treatment, everyone's going to have their own unique goals that are specific to their experiences. However, there are goals that we know are going to be common in treatment overall. First, we're looking for an overall reduction or complete elimination of eating disorder behaviors and symptoms to help build better insight into eating disorders and how they can affect us. The development of skills and strategies to help you cope with stressors and challenges that you may face in your life. To have a kinder or gentler relationship with yourself and your body. To have an improved relationship with movement and exercise. And overall, for you to feel more in control of your life.
Thank you for watching Module 2 of our Eating Disorder 101 workshop. Join us in our next video to learn more about the impacts of diet culture and how to support yourself or a loved one with an eating disorder.